Over the past couple of years, there's been a lot of complaints and news about how prior authorizations are negatively impacting members of Medicare Advantage plans. Just take a look at some of these headlines. Analysis: Medicare Advantage prior authorization requests increased by 9 million in 3 years. When prior authorization becomes a medical roadblock. Bipartisan prior authorization legislation is introduced. Prior authorization is wreaking havoc, AMA survey. If you've been doing any research into Medicare Advantage plans and watching any videos here on YouTube, then you've likely seen some reports and some agents trying to strike fear into you about the perils of Medicare Advantage plans' use of prior authorizations, basically warning you to never choose a Medicare Advantage plan. Now, there is no doubt there's been issues with prior authorizations and people have been denied coverage when they shouldn't have, and I've mentioned this in numerous videos that you can check out later. Links are in the description. But as an agent, for me to tell you to avoid, be scared of, and run away from Medicare Advantage due to prior authorization issues is, in my mind, a violation of my fiduciary responsibility to you to review all of your Medicare plan options and to let you know the pros and cons of each. It is also misleading to Medicare beneficiaries to imply that Medicare Advantage plans should be avoided at all costs because of the potential of prior authorizations and benefit denials. So in this video, we are going to look at the facts and actual numbers when it comes to the likelihood of dealing with a prior authorization on a Medicare Advantage plan. Hi, I'm Chris Browning, the Medicare analyst. I'm a licensed agent in 14 states and I am based out of Charlottesville, Virginia. Maximizing your Medicare should be very important to you, and my goal is to help people like you make a wise and confident decision about all of your Medicare choices so that you can protect your income, your assets, your savings, and your health. If today is your birthday, then a very happy birthday to you. Gabriel Byrne said, "Presents don't mean much to me. I don't want to sound mawkish, but it was the realization that I have a great many of people in my life who really love me and who I really love." So here we go. According to a recent report from the Kaiser Family Foundation, here's what they found. Number one, the number of prior authorization requests submitted by Medicare Advantage insurers for their enrollees increased by about 25% from 37 million in 2019 to 46 million in 2022, according to the Kaiser Family Foundation. Of course they did, because enrollment in Medicare Advantage plans went up during that time. As a matter of fact, the report indicated, quote, in 2022, there were 1.7 prior authorization requests per Medicare Advantage enrollee, similar to the amount in 2019. The rise in the total number of prior authorization requests corresponded to increasing enrollment in Medicare Advantage and so translated into a similar number of requests per enrollee, unquote. Number two, MA insurers fully or partially denied 3.4 million prior authorization requests in 2022, which represented 7.4% of all requests. That is an increase from 5.7% denied in 2019 and 5.8% denied in 2021. What? How many were actually denied? Oh, it was only 7.4%, meaning 92.6% were actually approved right out of the gate. So wait a minute. The way some people make it sound, I thought the majority of prior authorizations were denied. Number three, now get this. Of the prior authorization requests that Medicare Advantage insurers denied, only 10% were appealed in 2022. While only a small fraction of denials were contested, the appeals were largely successful. 83.2% of them resulted in overturning the initial denial. Only 10% appealed? Why not more? Maybe the treatment truly wasn't needed. Maybe the person recovered. Maybe it turned out to be another health issue, or the treatment was actually covered under another medical code, which is quite common. Regardless, when you see that 83.2% of appeals were actually overturned, that tells you and your doctor you better appeal the decision if the treatment is really needed. Now just think, if 100% of prior authorizations were appealed and 83.2% got overturned or approved, what would be the actual chance of someone getting denied coverage? So if there were 100 prior authorization requests and 7.4% were actually fully or partially denied originally, then if those 7.4% denials were all appealed and 83.2% of them got overturned or approved, 6.16% would end up with an approval, thus leaving only 1.24% of prior authorizations denied. That doesn't sound as bad as some people are leading you to believe. 4, Humana had the highest number of prior authorization requests at 2.9 per enrollee. 5, CVS denied the highest percentage at 13%, and 6, Humana had the lowest percentage overturned at 68.4%. Here are some things that you need to keep in mind and usually aren't told when people try to scare you about prior authorizations and Medicare Advantage. One thing you may not have been told is that even under original Medicare, there are many treatments that require a prior authorization. Just take a look at this list. The link is in the description. According to a recent survey done by Premier, they came up with apparently different results showing 15.7% of Medicare Advantage claims were initially denied. But what you don't hear from the naysayers is that Medicare itself initially denied 8.4% of claims. They lead you to believe that original Medicare never requires a prior authorization or denies coverage. And that obviously is a big lie and is deceiving. Premier also indicated that 52.7% of denials on Medicare Advantage plans were overturned compared to 50% on original Medicare. So what about issues with prior authorization? Unfortunately, prior authorizations do cause real issues for patients and providers. Delays in care. Sometimes when it comes to your health, every second counts. There should be a real solution when a prior authorization comes to imminent life or death situations. 24% of physicians have reported that a prior authorization led to a serious adverse event. The halting of care even when progress is being made, not uncommon in a skilled nursing situation. In an article on the NIH website titled Prior Authorization, Overwhelming Burden and Critical Need for Reform, it stated patients who were denied coverage or discontinued treatment had significantly higher rates of acute coronary syndrome, coronary intervention, stroke, and cardiac arrest compared to those who took the medication. Unquote. Increased costs for the patient that now may have to pay out of pocket for care. Increased admin costs for providers. The average admin cost for dealing with a denial when it comes to Medicare Advantage is $47.77. That might not sound like a lot, but that really adds up when you are a large provider. Comparatively, the admin cost for denial under original Medicare is only 79 cents. Plus, providers may have to wait longer to receive payment from a Medicare Advantage plan. The biggest issue with prior authorizations when it comes to Medicare Advantage is skilled nursing or post-acute care. Medicare Advantage plans initially denied 20.1% prior authorization requests, whereas original Medicare initially denied only 3%. However, and very importantly, there is a valuable reason why prior authorizations are in place. One, it prevents a patient from truly receiving unnecessary treatment. And if you doubt this, check out the book, The Price We Pay by Johns Hopkins doctor, Dr. Marty Makary. I couldn't believe all the unethical and unnecessary treatments some providers do. 2, it prevents a patient from getting a medication that may be more harmful than helpful. 3, it prevents a patient from getting a treatment that could be detrimental to their health. 4, and of course, saves the insurance company money and hopefully, therefore you money as well. So what can we truly conclude when it comes to prior authorizations and Medicare Advantage? Well, they exist for sure. They are not as severe as some lead you to believe. They can and do serve a positive purpose when it comes to your healthcare and your costs for healthcare. But there are plenty of times where they negatively affect patients and providers and are or can be detrimental to your healthcare or your healthcare outcome. I hope that you have found this helpful. It is my goal, as always, to bring you an honest and balanced view of all things Medicare based upon the available sources, studies, surveys, and real-world happenings. And just in case you're wondering, I'm not one of those agents that pushes Medicare Advantage because agents supposedly earn a greater commission on them. I've addressed that falsehood in another video. If you want one of those agents, just call one of the 800 number TV ads and you'll get one for sure. The majority of my clients, whether they are in Virginia, Florida, California, typically get a Medicare supplement plan and or a Plan G along with a Part D drug plan. If you have any questions about what I've just gone over and when you're ready for my help in maximizing your healthcare and retirement insurance coverage and making a wise choice when it comes to all of your Medicare insurance options, and you live in one of the states that I'm licensed in, which you can see here, then please feel free to reach out to me either by phone or through one of my contact forms on my website. We will have an open and honest conversation about your healthcare needs and philosophies and budget. I'll do my best to answer any questions or concerns that you may have. And once we determine what is best for your unique needs and budget, I will then enroll you in the plan or the plans of your choice, and of course, be available down the road for your support. To stay up to date and to gain more insight on maximizing your Medicare insurance, then please go ahead and subscribe. And who do you know who may benefit from this info? Please share it with them. I'm Chris Prang, the Medicare analyst. Make it a great day.